Good evening, class. I welcome you to our chapter of today, Radiology, Medical N6, Medical N5, sorry. So we are just going to quickly go through the content of today, such that we don't take a lot of time. Definition of radiology is a branch of medicine that uses imaging technology. It is a branch of medicine that uses imaging technology to diagnose and treat diseases. So we are saying this is a technological advancement or development in the field of medicine where imaging is used in terms of diagnosis and also treatment of diseases. And you know what? Doctors who specialize in radiology are called radiologists. Radiology is the study or it is actually a branch of medicine, but now the people or the specialists, our doctors who are working within that specialty are called radiologists. It is divided into two different areas, diagnostic and interventional therapeutic radiology. So diagnostic radiology focuses on all X-ray photographs used in enabling diagnosis, and using these images the radiologist diagnose the cause. Using the images, the radiologist diagnose the cause, monitors. He can diagnose the cause, can monitor. He can monitor how well a patient's body is responding to a treatment, the response of treatment or the response of a medication which a patient is administered to can also be evaluated and confirmed through diagnostic radiology. So I'm saying it is quite a very common. I mean, it is quite a very recent medicine branch which actually helps in terms of ensuring that the response or the treatment of diseases is comprehensive, and can also screen for illnesses like heart diseases. They can as well be what they can also be checked, and cancerous problems. They can as well be what we can also be able to screen their development or the way they have been established in a human body. So examples of diagnostic radiology exams include it includes computerized tomography, which is sometimes called CT scan. I'm sure that you have heard of that one. Computerized tomography. It is a CT scan, which is sometimes taken through the stone. I mean, through the throat. It can also be taken within the gastric parts of the body, which is like inside the stomach. And we also have magnetic resonance imaging, which has to do with also with the more advanced way of taking of X-rays. And also we have got what is called the general plane X-rays. Also, we have got the general plane X-rays. So we also have therapeutic or interventional radiology, which is used to guide procedures, especially when inserting catheters. When a catheter is to be inserted, the interventional radiology is also the approach. Wires and other small instruments when they are being put in the body is the therapeutic radiology that deals with those. So what happens again is that they often help in treating cancers, treatment of cancers, tumors, blockages, and arteries in the vein. They can as well be checked through. They can as well be checked through what? Through therapeutic radiology. And then examples of these include feeding tubes placements, embolization, and also embolization to control bleeding or venous access catheters. They also fall as examples in this regard. X-rays of the flesh are invisible. They show there is a shadow or they represent a shadow. X-rays of the flesh are invisible because the röntgen rays penetrate the tissue, unlike for the bone. So in order to see or to take a proper, I mean, in order to have an X-ray, we are saying in this reference of flesh ones, they are not quite clear because there is a shadow that appears there as a result of the Röntgen rays that will penetrate through the skin, unlike when an X-ray of a bone is being taken, which is actually quite clear and visible. And then we can also talk about different X-ray procedures. Before X-rays of hollow organs are taken, other organs, we are talking about body components or body parts which have got an opening. So it must be filled with a radio opaque medium, which is the colorant. Sometimes these substances, they prevent and stop the passage of X-rays. So therefore, we can be able to take a clear imaging of the X-ray of these hollow organs that we are referring to. Uh, Outlines of the organs then show up on the X-rays, and filling defects as a result of tumor will be indicated. So as a result of this, what we are saying is that uh, X-rays of hollow organs, they need this, what you call, they need this the radio opaque medium, which can also be used in filling defects, and also in order to identify uh tumors that can also be growing. For esophagus, stomach, and duodenum, a barium meal is taken, which is a barium meal is taken, while the X-ray will be taken after 14 hours. After taking the barium meal, the X-ray can be taken after 14 hours. Again, the gallbladder, some pills are taken in first, which must be secreted to it, and then the X-ray may be taken while fasting, and later an extremely fat meal is taken, regarding, or we are referring to, the X-ray of the gallbladder, where some pills must be taken first and must be secreted to it, and then the X-ray may be taken while fasting, and later a person can eat a very fatty meal. Kidney, urethra and bladder, contrast medium are also intravenously administered. That is, they are administered through the vein. The kidney and the urethra, as well as the bladder, we are saying there is a contrast or a coloring substance which is administered, or which is given through the veins. We also have types of X-rays, the tomography, types of X-rays. We have got what is called the tomography, is taken of any body part, including the pathology exactly. It also shows the pathology. It reviews all unclear images. The tomography, all unclear images are also reviewed. Is mostly used for evaluation of dentistry and fracture healings. So in terms of this, we are saying they have to do with the mouth, and also the gums, and also the toothaches. We are saying a tomograph is the best one. It is used in evaluation of those, as well as fractures that sometimes maybe it can be accidents where bones are broken. They can as well be evaluated through what? Through tomography. And then we have got the cholesterography, which is an X-ray for all gallbladder after radio opaque material. This one, please take note that sometimes, most often, it is given, or it is asked as what? As true or false questions. What is it? What is defined this? Is it true or false? So we are saying the cholesterography, it's an X-ray for gallbladder after a radio opaque material has been administered. Remember, we said again, uh, it can be also be administered through the veins, that is intravenously. And then we've got the pelography, which is examination of the kidney. It is examination of the kidney, that is pelography. It's an examination of the kidney. In medical practice, quite a lot of times we have got times where, we have got terms that need to be defined, which is like the scientific terminology that is used within the subject. Let's look into this one. Mammography, it is used for evaluation of breast tissues. Mammography, it's also an X-ray that is used for evaluation of breast tissues. And then computerized tomography, skeleton and soft tissue evaluation. It is done through, it is actually done to evaluate the skeleton and soft tissue evaluation. That is computerized tomography. Uh, Magnetic resonance. Magnetic resonance, actually, it is a form of X-ray again, where a person has to, or a patient must move through a long tunnel, which is an opening which has got some magnets within it. So during the examination, the person must move through that long tunnel, and then it contains a big magnet, which in this regard also we need to understand that people or patients who have got previously been uh, treated, or they have got metallic objects or metallic treatments in their body, those cannot be they cannot be allowed to go through magnetic resonance, because you know the relationship between metallic items and magnets. So what we are saying is that any patient who who were previously uh, having metals in their body, or who previously got stitches which are metallic, uh, was used during the surgery, may not undergo this examination. They cannot undergo through this examination. Any part of the body may be evaluated anyway when a person goes through a magnetic resonance process, which is a form of checking through the whole body. It can evaluate the whole body. However, it is not allowed, or it is not accepted for people who have got metals uh, in their bodies. Characteristics of X-rays, their short wavelength, they've got a short, their short wavelength and high energy enable them to penetrate light impenetrable materials. So what we are saying is that X-rays can enter or can penetrate through impenetrable material because of their what shortwave length and also high energy, which cause some chemicals to fluoresce and also react with photographic films, which also produces a visual record and affect bodily tissues. So what we are saying is that when an X-ray is taken, they are also ways of it, or they provide a photographic film that has got a visual record, which can also affect the bodily tissues in some ways. Advantages or uses of X-rays. X-rays help in locating strange objects. X-rays are taken, or they can be taken to patients who have gone through surgery, who have gone through theater, where they've gone through some operations and stuff. So in that respect, foreign objects or strange objects that might have been left in the body can be identified, and then facilitate dental processes. I'm sure that you have heard that above there we talked about what is it? We talked about the type of uh, of of X-rays which are used in terms of what in terms of dental treatments. So they help also in terms of dental processes, X-rays, in order to understand the gums, in order to understand the jaws, in order to understand what in which is in that respect, X-rays can be used. They help in diagnosis of diseases. Diseases can be diagnosed. We said the extent to which a disease is established in a human body can be seen through X-rays. And also, in that regard, as much as that is known, the treatment and management of the disease can be done. Such diseases can be managed or can be treated very well if that has been done. Disadvantages or effects of over radiation, it results in sterility, that is an inability to produce viable eggs that can be able to fertilize. So as a result of X-rays, as a result of over radiation, it results in infertility. It results in infertility, where people can no longer have, or individuals might not be able to have to have children. And then we have got apostolic anemia as a result of bone marrow compression and carcinoma, which are also forms of some cancerous problems. And then the compression of bone marrow, which is also a problem that might also result from over radiation, or as a disadvantage of use of X-rays. So what I'm saying is that please take note and refer to previous question papers. I have already posted some questions, previous question paper, which have got questions that relates to this chapter. So I just did so therefore you can be able to understand and see the application as well as the comprehensiveness of the chapter with regard to in national examination questioning techniques. So thank you so much and have a beautiful day. Uh, don't forget to just keep on following the channel by turning on your notification button so then we can keep connected. All the best. Revision for national final examinations, end of semester are coming, full papers are coming. Please watch out and follow those. We will never go wrong. Have a beautiful day.